And it's you know, Dr. David Florence. I'll just tell you this last quick story. Josh, maybe you can put this in there because this will be, oh, you are, okay. Dr. David Florence was a doctor that came through one of my training programs. So he was telling me this story. We were at a conference about a year ago, and he was, we were talking about what happened in the hurricane, and he has really tried to do many of the things that we've talked about doing. So he had been part of that experimental group that went out, all medical doctors, and trying to shift the clouds, and we did that. So he's at this conference, and it was an anti-aging conference. And it was really funny because at this anti-aging conference, they were auctioning off a big screen TV, plasma, 60-inch plasma TV. About 5,000 people that were present there. And he's talking to this rep from this company, and he said, you know, it's really unfair. It wasn't an auction, it was a drawing, I'm sorry, it was a drawing. He says, it's really unfair because all these people think they're going to win this plasma TV, and I've already won it. And she goes, you've already won it? What do you mean? He goes, I've already won it. You know, I've already set the intention, I've already won it. And I don't know who this lady was, but she goes, oh, you must have like been talking to Dr. Buttar. And he goes, oh, you know Dr. Buttar? And she apparently knew me from somewhere. I guess maybe we did some business with that company, I don't know. But apparently she knew who I was. And he goes, yeah, he's taught me how to do this, and yeah, I've already won this. And she's like laughing and telling him what a goofball he is, you know. And meanwhile, you hear this shriek, and this girl comes running down the middle aisle with a 6 DVD changer, you know, those movie things that she'd won it, and it was his nurse. And he goes, see, I told you. And she goes, that's your nurse, and that's not the TV. And he goes, I'm going to win the TV, though. And she's like, yeah, right, whatever. So he gets up. He goes, well, I got to go down and get the TV. They hadn't even announced it. And he just starts walking down, you know, this long corridor, I mean, there's booths everywhere, and they're getting ready to announce it. You know, the winning ticket, and he just walks, you know, and she's like laughing at him. He walks up, and when he's about maybe 100 feet away, you know, they announce the winning number. And he just walked right up there and pulled out his ticket and gave it to him, and they congratulated him, and he's got this TV. And he comes back, and the woman that he was talking to was having chest pain. She was like literally having chest pain. She was like freaking out, going, you know, and having to sit down. But it all comes down to what you really believe. And I really believe that you can do these things. I know because I've already seen it. I've already witnessed it. Even though sometimes, you know, the conscious mind comes in and says, it's not possible. You just think it. It's a coincidence or whatever. Guess what? Anytime you have doubt that it comes in there, it ruins it. So we actually teach at the Build a Successful Life seminar, we actually talk about a specific way of manifesting. So there's specific rules in how you do it. But it comes down to a choice and a belief. And, you know, it's not really part of this topic, but it's true. I mean, part of this is about, you know, does a person want to get better? Do they want to get better? And sometimes people don't want to get better, believe it or not. And so that's where, you know, when you talked about his intention, the patient's desire to want to help and to get better and to do their part, absolutely makes a huge difference. How many people read the physician's prayer when they came in? When you guys walk out tonight, I want you to, as you walk out of the door, I want you to stop, and I want you to turn to your left, and I want you to raise your head up, and I want you to read it. Okay? But that'll be an interesting thing for you guys to do. So I appreciate everybody coming. Any other things anybody wants to talk to me about individually, I'll be happy to stay for a few minutes. There's a lot of cool things that we can talk about. Unfortunately, we don't have time. If anybody gets a chance, go to this site called what's the site? transd.com. Go to transd.com and just see. Yeah, just go to transd.com and just check that out, okay? I'm not into peddling anything, but this is something that just went over the counter. We developed this 11 years ago. It's only been available through the doctor's market. Josh, scroll down a little bit. Is there any faces that we'd recognize, that they may recognize taking this? Well, besides that face. That was actually at the Emmys. E-News was interviewing me at the time, but there's a lot of people that are taking. But anyway, just go check out the website. I think you guys might be intrigued by what you find in there. It's something that actually, Josh, go back up to the. If you already have a hormone imbalance, is that something that would complicate it more? This is the only thing that'll straighten it out. You need to cut them off all hormones because this is way up, rebalances the hypothalamic pituitary adrenal axis. That's the question you got to ask. Could 1,889 of the most progressive doctors in 27 different countries, after dispensing 22.7 million doses over the last 10 years, all be wrong? This is one of those products that's so unique that doctors would tell other doctors it doesn't work only because they didn't want the other doctors to use the product and get patients. They didn't want to compete with them. Honest to gosh. But anyway, it's a product that's, you just read about it and you may be interested in it, and it's now available to anybody if they're interested, and you don't need to go see a doctor anymore. All right, great. Thank you very much. And Josh, if anybody wants to go see anything, I guess we can kind of walk them through.